Welcome back, everyone. We're diving into something super interesting today. It's the world of endometriosis, but seen through the lens of Ayurveda.
Oh, yeah. Definitely fascinating stuff.
We've got this case study, actually,
Oh, cool.
published in the International Journal of Ayurveda and Pharma Research. It's
Cool.
about a 24-year-old woman dealing with this condition.
That's a good one.
Mhm.
I think this would be a really good deep dive because it really shows how Ayurveda can be a different way to look at a condition that so many women have. I mean, globally, it's like 1 in 10.
Yeah, and that's millions of people
Yeah.
dealing with extremely painful periods, pelvic pain, and, even difficulty getting pregnant.
Yeah, it can be really debilitating.
So before we get into the specifics of this case, let's just break down what endometriosis actually is, like for someone who's hearing about this for the first time.
Yeah, for sure.
Yeah.
Imagine the lining of your uterus, the lining inside. But instead of staying put, it starts growing outside the uterus.
Oh, wow.
Yeah. So it could be on your ovaries, fallopian tubes, even sometimes like on the bladder or intestines.
Oh, my gosh.
Yeah, and just like the lining inside, this tissue reacts to your menstrual cycle.
Oh, so it's
So
still,
it builds up and breaks down every month.
it's like having your period in all the wrong places.
Exactly.
Yeah.
That's a really good way to put it.
Right.
And because this tissue can't leave your body like a normal period would, it gets trapped.
Oh, I see.
And that's what leads to inflammation, the pain, those cysts that people might have heard about.
That sounds so painful. So I can see why so many women are looking for different treatment options. So this brings us to Ayurveda and this case study. Before we talk about this 24-year-old patient, can you give us like the Ayurvedic perspective on this kind of condition?
Yeah, so in Ayurveda, we see the body as like this whole interconnected system. We're not just trying to treat the symptoms, but trying to find like the root cause of the imbalance.
Okay.
So we talk about the Tridoshas, Vata, Pitta, and Kapha. They're like energies that control different functions in the body.
So would endometriosis be seen as like a disruption of one of these doshas?
Yeah, often, especially Panavata. That's the energy that's responsible for like downward flow in the body,
Uh-huh.
which includes your period.
Okay, so I'm trying to picture this. So if Apanavata is disrupted, it's like things are going in the wrong direction. Is that what leads to the tissue growing where it shouldn't?
You're getting it.
Yeah.
It's not a literal backwards flow, but think of it as a disruption of that natural downward energy. And yeah, that can contribute to endometriosis.
Fascinating. So tell me about this 24-year-old patient. What was she experiencing?
She was having really intense symptoms, like really heavy bleeding, uh, debilitating pain, even vomiting.
Mm-hmm.
And through an ultrasound, they confirmed she had an endometriotic cyst on her right ovary.
Wow, that's a lot. Did they find any like potential factors that might have led to her condition?
Yeah, the case study mentions she had a diet high in like oily and fried foods, what we call mithya ahara in Ayurveda, basically improper diet.
Okay.
And there was a family history of uterine fibroids.
So both diet and genetics could have played a role. Okay, so let's talk about the treatment. How did the Ayurvedic practitioners approach this?
Ayurveda is all about personalized treatment.
Yeah.
So it's not one size fits all. They really looked at her symptoms, her medical history, her individual constitution to make a plan just for her.
So I'm really curious, where did they start?
The first phase focused on what we call Amapachana,
Okay.
which basically means getting rid of toxins from the body.
Yeah.
And they also wanted to look at her Agnideepana, which is like the digestive fire.
So it's like they're laying the groundwork for healing
Yeah.
by creating a cleaner environment internally and helping with digestion. Makes sense. What did they actually use to do this?
So they used a combination of herbal medications. In this first month, she was given Saptasaram, Kashayam, Sukumara Grutam, and Rajapravartini Vati.
I have to admit I'm not familiar with those. Can you break them down, like what they do and why they chose them?
Yeah, so for example, Saptasaram Kashayam can help to relax muscles and ease pain, which is obviously super important given how much pain she was in.
Mm-hmm.
And Sukumar Gutam is a special preparation where they infuse herbs into ghee.
Oh, ghee.
Yeah,
I've heard that's really good for you.
yeah. Ghee is believed to have lots of nourishing and healing properties. And in Ayurveda, it's thought to help carry the medicinal properties of herbs deeper into the body.
Okay.
Sukumar Gritam is often used to balance Vata and promote healthy menstrual flow.
That's interesting. So it's not just the herbs themselves, but the way they're prepared.
Exactly.
What about Raja Pravartini Vati?
That one's like a classic Ayurvedic formula specifically for menstrual issues. It works on a bunch of levels to regulate the cycle, reduce pain and inflammation, and improve circulation.
It sounds like they're really hitting it from all angles,
Uh-huh.
addressing both the symptoms and the underlying imbalances.
Yeah.
So after a month of this initial treatment, what happened?
There were some really good changes.
Oh,
Her bleeding went down a lot, her pain lessened, and her period even came back after being absent for 2 months.
wow, those are really encouraging results after just 1 month. It seems like this personalized approach was really starting to work. But I know this is just the beginning of her journey. What happened next?
Right. It's just the first step.
Mhm.
Ayurveda, it's a process. It's not a quick fix.
Hmm.
So as her body started responding, they changed her plan a little to address the next stage of her condition.
That makes sense. So what was the focus of this second
Well,
phase?
now the goal was to tackle the inflammation and try to shrink that endometriotic cyst.
Okay.
So they brought in some new herbs like Sukumaram Kashyam, Kantasindaram, Aparishtam, and Kalyakashuram. Oh, and they added a topical oil too, Pindatalam.
A topical oil. I've never thought of using something like that for endometriosis. It's like they were really coming at it from all sides.
Yeah, exactly. Each of these new additions,
Yeah.
had a very specific purpose in terms of her imbalance. For example, Sukumaram Kashayam is great for inflammation and digestion. And then Kantha syndrome is really unique. It helps to improve blood quality and circulation.
Okay, so the right tool for the job. You mentioned Abhirashandama before. What's interesting about that one?
Okay, so it's traditionally used for hemorrhoids, but it's also really good for regulating Apana Vata,
Right.
that downward flow we were talking about.
Uh-huh.
So, when Apana Vata has messed up, it can contribute to that backflow that leads to endometriosis.
I see.
So Apirishtam helps to restore that natural flow and reduce inflammation.
So they're going after the root cause and the symptoms at the same time. What about Kalyana Kashuram? That one sounds kind of intense.
It is a powerful one. It's made with these alkali salts that are caustic, so they can actually help to break down growths like cysts.
Wow. So they're really going right for that cyst.
Yeah.
And what about that topical oil, Pindatalam? How does that fit in?
Well, think of it as like targeted relief, right where she needs it, on her lower abdomen. It helps balance Vata and Pitta, which are often out of whack with endometriosis, and it just has like a calming effect on the inflammation in that area.
It seems like they thought of everything. So with all these new additions, how did she respond to this second phase?
The results were super promising. After 3 months, her periods were regular again, the bleeding was only 3 days, and her pain was much better.
That's incredible. But what about the cyst? Any changes there?
That's the most amazing part. The ultrasound showed that it had shrunk a lot.
Really?
Yeah, so it was clear that this multi-layered approach was working, but there was still one more phase to go.
Okay, I'm on the edge of my seat. What did they do in that final phase?
So the third phase was all about making sure the progress she made stuck and dealing with any lingering imbalances.
Okay.
So they introduced Majestati Kashayam, Kasura Gugulu, Sarabhadyasavam, and Avipathy Churna.
I'm realizing Ayurvedic medicine is a lot more complex than I originally thought. Each of these herbs, it does something so specific, and the way they're combined and adjusted over time, it's fascinating.
Yeah, it's like this carefully choreographed dance between the body's needs and these healing plants.
So tell me about these final herbs. What made them the right choice for this last part of her treatment?
Okay, so Manjustati Kasham is known for purifying the blood and reducing inflammation. Remember how we talked about that tracked blood and tissue being part of the problem?
Yeah,
This one helps to clear that out and get the circulation going.
that makes sense. What about Kaisora Gugulu?
Kaisora Gugulu is another one that's great for inflammation and promoting healing, and it also supports the immune system.
It sounds like they're setting her up for success in the long run. What about Sarabadasavam? I think you mentioned that one earlier.
Right, that was part of the second phase, too.
Oh, okay.
It helps to purify the blood and improve circulation, so it was still important in this final phase.
So they're like building on what they've already done.
Exactly.
And what about Avipathy Churna? What does that do?
Avipathy Churna is all about digestion and getting rid of toxins. It helps to balance those doshas, Pitta and Kapha, that we know can be a factor in endometriosis.
So they're making sure her digestive system is working well and that her body can get rid of anything that shouldn't be there.
Yeah.
It's amazing how they're looking at this from so many different angles. Okay, so after 7 months of this whole journey, what was the final result?
The results were incredible. The ultrasound showed that the cyst was totally gone,
Wow.
and her symptoms were so much better. She had regular cycles, manageable bleeding, and the pain was way less.
That's a huge testament to what Ayurveda can do. It's inspiring to see how this ancient system can be so effective. Do you often see results this dramatic with endometriosis?
Well, everyone's different, and how they respond to treatment will vary.
Mm.
But this case study really shows what can happen when you address the root cause
Hmm.
and, support the body's natural ability to heal.
It's a reminder that there's more than one way to heal.
For sure. And while Ayurveda can offer some great solutions, it's not about replacing conventional medicine.
Right.
It's about finding what works best for you as an individual.
That's such an important point. It's about having options and making informed choices for yourself. You mentioned earlier that Ayurveda is about working with nature's rhythms. What does that actually look like in practice, especially for someone with endometriosis?
That's a great question. It's about tuning into your own body's natural cycles and making choices that support those rhythms.
So it's not just about herbs, but about lifestyle too.
Yeah, exactly. It's about taking a holistic approach, one that nourishes your mind, body, and spirit.
I'm really interested in that. What are some specific things someone can do to start aligning with those rhythms?
Well, one of the most important things is paying attention to your diet.
Okay.
Ayurveda is all about eating fresh whole foods, things that are in season and prepared with care. Put some love into it.
That sounds delicious. But how does that connect to endometriosis specifically?
Well, endometriosis often comes with a lot of inflammation. So choosing foods that are naturally anti-inflammatory can really help, like leafy greens, berries, turmeric, ginger, things like that.
So making food choices that help your body heal.
Right. And then beyond diet, it's about setting up a daily routine that supports balance and consistency, like going to bed and waking up around the same time every day, getting regular exercise, and making time for relaxation and stress management.
So building a rhythm that works for your body and your life.
Yeah.
What about stress? I know that can be a big deal for a lot of women, especially with chronic pain.
Oh, absolutely. Stress can really mess with our hormones and make inflammation worse. So finding healthy ways to manage stress is huge.
What are some of your favorite ways to de-stress?
Yoga and meditation are so powerful. Even just taking a few minutes every day to breathe deeply and quiet your mind can make a huge difference.
I have to admit, when we started talking about Ayurveda, I was a little skeptical, but the more I learned about it, the more it makes sense. It's about really listening to your body, understanding your needs, and making choices that support your overall well-being.
That's it. It's about giving yourself the power to take control of your own health and creating a life that feels good and vibrant.
Okay, so we've covered the basics of endometriosis, the Ayurvedic perspective, looked at this case study in detail, and even talked about some lifestyle changes that can help with healing. But before we wrap up, I want to go back to something you mentioned earlier, the emotional side of endometriosis.
Yeah, we can't forget about that part.
Yeah.
Living with chronic pain and all the uncertainty that comes with endometriosis can be really tough emotionally.
It's important to remember that it's not just physical, it affects everything.
Exactly. And it's so important to remember that you're not alone. There are so many resources out there to support women with endometriosis.
Like what? What are some things people can do to find that support?
Well, there are organizations like the Endometriosis Foundation of America. They have tons of great information and resources. And there are online communities where women can connect and share their experiences.
It's so important to connect with people who get it. It can make you feel less alone and more confident to advocate for yourself.
Definitely.
Definitely.
And beyond that, external support. It's really important to practice self-compassion. Endometriosis can be like a roller coaster. So it's okay to not be okay all the time.
That's such a good reminder to be kind to ourselves and allow space for whatever we're feeling.
Yeah. Healing takes time, and it's not always a straight line. There will be ups and downs, but it's about finding ways to support yourself through the whole thing.
So we talked about finding support, but what about taking charge of your own health? What are some things people can do to start advocating for themselves?
I think one of the most important things is to educate yourself about your condition.
Right.
The more you understand about endometriosis, the better you'll be able to make decisions about your treatment.
And to find practitioners who really listen to you and understand your needs.
Exactly. And it's about finding a healthcare team that you trust and feel comfortable with.
It's been amazing to learn about this case study and how Ayurveda can offer a different perspective on endometriosis. But aside from the specifics of this case, what's the one thing you want our listener to take away today?
I want them to feel empowered, to know that there are options out there and that they have the power to make choices that support their health and well-being.
That's a beautiful message. So as we wrap up this part of our deep dive, what are your final thoughts?
Endometriosis can be a tough thing to deal with, but it doesn't have to define you. There is hope, there's healing, and there's a whole community out there ready to support you.
That's so reassuring. And remember, this is just the beginning. There's always more to explore and discover. All right, so we've talked a lot about aligning with nature's rhythms, but what does that actually look like in real life? Especially if you're dealing with endometriosis.
Well, it's kind of like helping your body heal itself naturally.
Okay.
It's about making choices that nourish you in every way, physically, mentally, emotionally, the whole package.
So where do we even begin? What are some things our listeners can actually do to bring these ideas into their daily routine?
Let's start with diet. Remember how we were talking about inflammation being a big part of endometriosis?
Yeah.
Well, Ayurveda has a lot to say about how food can either make inflammation worse or help fight it.
So it's not just what you eat, but how you eat too.
You got it. Mindful eating is huge,
Yeah.
really slowing down, tasting each bite, paying attention to how different foods make you feel.
Right.
And then on top of that, choosing foods that are naturally anti-inflammatory and good for you overall.
Okay, so what are some examples? Like, what are some of your favorite endometriosis-friendly foods?
Think color. Leafy greens, berries, beets.
Okay.
Those are packed with antioxidants, which help fight inflammation. And turmeric and ginger are awesome, too. They're super anti-inflammatory.
So those are good things to add to your diet.
hmm
What about things to avoid?
Processed foods, refined sugars, too much caffeine, all of those can actually make inflammation worse. So those are best to cut down on. And, everyone is different. So what works for one person might not work for someone else.
Yeah. That's why paying attention to how your body reacts is so important. It's like you're a detective for your own body.
Exactly. And, besides diet, Ayurveda is all about those daily routines that create balance and consistency. Waking up and going to bed around the same time each day, getting some exercise regularly, and making time to relax and manage stress.
So it's like having a rhythm to your life that brings some stability.
Yeah.
But how does that actually help with endometriosis?
Well, when we're stressed all the time and out of sync with our natural rhythms, it can really mess with our hormones and make that inflammation worse.
Right.
But when you create a routine that focuses on self-care and reducing stress, it can help bring those systems back into balance and really support your body's healing process.
Okay, so routine and stress management are key. Any other practical tips you can share?
Especially for women, it's important to think of your menstrual cycle as a sacred time, a time for renewal. This could mean resting more during your period, doing some gentle yoga or meditation, and eating warm, comforting foods.
Mm.
It's really about listening to your body's cues and letting yourself slow down and just nurture yourself.
Yeah, it's like shifting from that mindset of pushing through and ignoring what your body's telling you to actually listening and taking care of yourself.
That's it. And this idea of self-care is really central to Ayurveda. Taking time for yourself, doing things you enjoy, and really cultivating self-love and acceptance. Realizing that your health and well-being are a priority, not something you just squeeze in if you have time.
This has been so insightful. When we started this deep dive, I was thinking mainly about herbs and treatments, but it's clear that Ayurveda is so much more than that. It's like a whole approach to life, a philosophy of well-being.
You nailed it. It's about understanding that true health and happiness come from living in harmony with nature. Both the nature inside us and the nature around us.
I love that. So for our listener who wants to try this approach, where's the best place to start?
I always tell people to do their research and find practitioners who they connect with. There's tons of great stuff out there, books, websites, online communities. And remember, healing takes time. Be patient with yourself, celebrate the small wins, and enjoy the process of taking care of yourself, body, mind, and spirit.
That's such a great reminder. What's really sticking with me is this idea that we have the power to take control of our own health. It's not about blindly following someone else's advice, but becoming an active part of our own healing journey.
Totally. It's about trusting your gut, listening to your body, and making choices that feel right for you and your needs.
Well, I think we've covered just about everything in this deep dive. We've explored endometriosis, the wisdom of Ayurveda, and most importantly, the power we all have to create a healthy and happy life for ourselves.
It's been a great journey, and I want to leave our listener with one last thought. No matter where you are in your journey, remember that you're not alone. There's a whole community of support out there, and there is always hope for healing.
That is the perfect way to end this. Thank you so much for sharing your expertise with us today.
My pleasure.
And to our listener, thank you for joining us on this deep dive into the world of endometriosis and Ayurvedic medicine. We hope you found this episode helpful and inspiring. Remember, the more you know, the better equipped you are to make decisions about your health. So stay curious, keep exploring, and as always, take care of yourselves.